Avascular necrosis, or AVN of the hip, can be a life-altering event, particularly for younger, more active patients that may face a prosthetic joint arthroplasty. One option available to these patients is the standard core decompression. Unfortunately, inconsistencies inherent with the technique may contribute to the inconsistent results seen in published literature. Through extensive testing and research, Wright has developed a revolutionary bone-cutting tool that expands in situ and can be used to debride hard sclerotic bone often found with AVN. Implementing this tool into a standard core decompression with the Core Decompression Procedure Kit is simple, provides improved tools for debridement, and introduces consistency and reliability to the surgical technique. Pre-operative planning is key for determining the appropriate treatment for individual patient pathologies. Using radiographic techniques, ensure that there is no collapse of the articulating surface of the femoral head and reconfirm stage 1 or stage 2 avascular necrosis. The first step is to access the lesion. Using a small stab incision, access the lateral femoral cortex in standard fashion. Using the Core Decompression Procedure Kit, select the 3.2 mm guide wire and introduce into the lesion under fluoroscopic guidance using both AP and lateral views. Keep in mind that most lesions are anterior and superior. Next, place the tissue protector over the guide wire and down to the bone prior to drilling. Using the 9 mm cannulated drill bit from the Core Decompression Procedure Kit, decompress the femoral head by drilling a core approximately 5 mm from the endosteal surface of the femoral head. AP and lateral fluoroscopic views should be used to confirm direction. Remove the drill bit and guide wire. Place the obturator into the working cannula and insert both through the tissue protector and into the core. Position the working cannula up into the core several centimeters. The fit should be snug. Once in place, remove the obturator and tissue protector. The advanced debridement can now be carried out using the X-Ream percutaneous expandable reamer. Introduce the X-Ream tool through the working cannula, confirming placement with fluoro in both AP and lateral views. To debride the necrotic bone with the X-Ream tool, begin by making a 1/4 turn clockwise on the blade control knob. It is extremely important not to open the blades too far prior to rotating the tool. Otherwise, blade failure can occur. Rotate the entire instrument 2 full revolutions to cut into the bone. Repeat with 1/4 turns of the blade control knob, then 2 full revolutions of the entire instrument until the blades fully expand or until the desired expansion width is reached. If the blades are open too far prior to cutting, turn the blade control knob counterclockwise until it stops and withdraw the instrument into the working cannula to collapse the blades. Reinsert the instrument and begin again with 1/4 turns on the blade control knob. During expansion, it is extremely important to frequently confirm blade position under fluoro in both AP and lateral views. While viewing on fluoro, be sure to rotate the flat instrument body perpendicular to the view so that the blade width can be clearly determined. Once debridement is complete, turn the blade control knob counterclockwise until it stops. Then remove the X-Ream tool from the core. The blades will self-collapse as the tool is pulled through the core. Next, use the suction tip to remove the debrided tissue. Flushing with a combination of irrigation and suction generally works best. Using the graft of choice, backfill the core using the appropriate delivery. In this example, ProStim injectable inductive graft is used to completely fill the surgically created bone defect. Begin by placing the needle at the back of the defect and injecting with thumb pressure. Slowly inject while simultaneously withdrawing the needle and working cannula to fill the core. If injection becomes too difficult, the delivery syringe offers a mechanical assist feature by simply engaging the white locking collar. Continue to inject by rotating the threaded plunger clockwise until injection is complete. Finally, confirm placement of the graft under fluoroscopic guidance and close in standard fashion.